Good morning and welcome to our webinar this morning from the Hutt Valley Chamber of Commerce. What can you do to protect your business and your people during the Omicron surge? We're here with the team from Rako Science. I'm Patrick McKibbin and I'm the CEO of the Hutt Valley Chamber of Commerce. What we're hearing from businesses with Omicron in New Zealand, the subject of rapid antigen testing and testing in general is a significant conversation and a big part of the business continuity response for the Omicron outbreak. Testing may enable businesses to keep operating and definitely keep their people safe. I'm delighted this morning to welcome Leon Grice, Executive Director at Rako Science, based in Wellington, and Piers Finch, Head of Commercial Partnerships at Rako Science, based in Auckland, to talk to us today. Rako Science provides saliva-based COVID-19 surveillance testing at scale to protect New Zealand workers, businesses and vulnerable communities. They have also been providing pre-departure PCR testing to international passengers leaving New Zealand. When Leon and Piers have completed their presentation, there will be an opportunity to answer some of your questions. If you have questions, please add them to the chat function on this live stream, and we'll do our best to get through all of them at the end. If we're not able to get through of them, we can follow up following this webinar, and please reach out to us if you need further assistance. I'm now going to introduce you to Leon and Piers to begin their presentation. Thank you.
Kia ora tātou, and thank you, Patrick. And g'day to everybody in the Hutt Valley from Wellington. I'll do a little bit of a background on who Rako Science is. My brother and I established this business with Sean Colgan, who is a friend of ours that we've known for a number of years. In September 2020, we licensed a PCR saliva testing technology from the University of Illinois because we have a relationship with the University of Illinois that goes back decades, research relationship. And we then validated and accredited the PCR saliva test and started testing in January 2021. And we started with Air New Zealand and with Amazon Film Productions. We now have testing collection sites from Whangarei to Christchurch, and shortly all the way down to Queenstown. We're in New Plymouth, Napier, Tauranga, Hamilton, Rotorua, and in many sites in Auckland. And we also have plans to open up in the Hutt Valley. We serve Southern Cross hospitals nationwide, Mercy Hospital in Auckland, the film industry, large corporates, and we also do PCR travel certificates. So we don't do any business for the Ministry of Health at all. There's a couple of times we've engaged with them, but that hasn't worked out. And our business is strong in the private sector. And yesterday we did 2,450 tests, and today we're on track to doing a similar amount. So we're doing about 10 to 15% of tests in the country, if not, and it'll probably continue to grow and our market share. I think one of the things that I wanted to focus on today is the announcements that they're going to have today and what it means for business. We've been working with many businesses now for now coming up to 15 months. And there's lots of things that businesses can do as well as testing. And we always like to make sure that people see all of the things that you can do to keep your business and your people safe. And testing is one component of that. And with the Omicron surge, I think, and the announcements today, I think it's even more important for you as businesses to think about what you are going to need to do, because essentially as we move into phase 2 and phase 3 of the red light system, and the Prime Minister will be announcing what that means this afternoon, but if you read online those systems, what we're going to be faced with is that testing won't be as available as it was before through the government system. That contact tracing will cease at some point. Close contact advice will cease at volume, and people will need to stay at home and recover from Omicron. and the access to the health system will primarily come through the primary healthcare sector. So your GPs, district nurses, they're going to become very important. So previously you'd ring Healthline and there would be support, structured support from a centralized system. That's not necessarily going to be the way things happen. So I've got a presentation which I won't show here, but it's available through Patrick. But Omicron is more transmissible. It evades immunity. Vaccines are very good, excellent even at preventing severe illness. But after a few months, immunity wanes. You'll get sick, but you're much less chance of suffering severe illness. And with Omicron, the thing what that means is that that we're going to have a lot more cases, a lot less hospitalization rate, but the amount of people going into hospital will be roughly the same. So in the US, in January this year, they peaked at 933,000 hospitalizations. Let's start again. They peaked at 933,000 daily cases, which led to 136,000 hospitalizations. So there'll be a lot more people that go positive, the asymptomatics, but those are the positive cases. The previous year, they had 252,000 peak daily cases and 142,000 hospitalization peak, a daily peak. So that was in January 2021. So Omicron leads to a far greater percentage of the population infected at the same time, a much lower rate of hospitalization. But because so many people are infected at the same time, we can expect hospitalization volume to be almost the same as the alpha outbreaks that were experienced in the Northern Hemisphere. So hospitalization rate down, but the volumes are likely to be high. We can see the same thing in Victoria. They're going through a population in Australia that is about as vaccinated as New Zealand. They're getting it during the summer, and they've had 2,286 deaths to date. So what's going to happen? The offshore experience suggests that there's going to be a 2 to 3 month sharp increase in cases, which could mean that we have a late March peak and a fall of cases in April. We know that contact tracing has been inundated, so the government's contact tracing system is not going to be there to support you as a business the way it has been previously. We know that PCR testing companies that depend on pooling, which is the entire New Zealand government testing system, will experience an 80% reduction in capacity, because with pooling and high rates of infectivity, positivity rates, then that will collapse in capability. The distribution of rapid antigen tests is required now. There could be delays there, and there'll be very high competition for access to those rapid antigen tests. There's 570 companies already that have applied to be considered to be critical services. The volume of positive cases means that public health authorities will provide text advice only that you're positive, or online advice. So the access to primary healthcare and GPs and nurses is going to be absolutely crucial. Critical workers who are close contacts, well, hopefully they can stay at work if they can get a negative rapid antigen test. So without government contact tracing, employers and your teams are going to need to identify who the close contacts are so that you can protect your workforce. So that's what's going to happen. What does it mean for your workforces? Well, there's going to be a lot more people sick at the same time, and most of them, fortunately, because we've got very high rates of vaccination in New Zealand, will have mild to moderate illness, and some won't have any symptoms, but they'll still be just as infectious to other people. And some will have virtually no symptoms. Some people will feel like it's a bad cold, and others will be hit like the flu, and they'll struggle to get out of bed. And also some will end up with post-infection chronic fatigue, known as long COVID, which has some nasty impacts. So for business continuity, and what you've got, the biggest challenge is attrition that will take down your workforce. So the question is how do you flatten the curve amongst your workforce, and how do you support your staff? Well, self-reliance is the order of the day. I've got 4 points for flattening the curve. You need to encourage behaviours that flatten the curve of infection. And that, of course, is all the things that you know: mask wearing and social distancing and good ventilation. The second thing is, if your teams haven't had a booster, you really want to encourage them to get a booster, particularly since it'll give them immunity for between 40 to 60 days, and then that immunity will wane. They'll still be protected against severe infection. But a booster at this moment in time is probably one of the best things you can do to flatten the curve of infection amongst your workforce. I think third thing is use the summer advantage for natural air ventilation, outside morning teas and lunches, etc. Mask wearing works, and so does social distancing and good hygiene. So that's flattening the curve. The second thing is you should be supporting your workforce. For positive cases, I would recommend setting up telephone trees. You should be talking to the Chamber of Commerce about getting the right questions to ask in the morning and the afternoon, to ask the person who works for you how they're doing, do they have food, how is their health, and getting those questions and setting up a spreadsheet and making sure that you're ringing, at set intervals, and you're following up and making sure that they are supported. I think you should be creating a system for identifying close contacts and how you reach out to those close contacts, and come out with your policies of how to manage that. I think you should be looking to how do you connect to primary healthcare, the GPs in the region, in your area, and how do you get referral pathways for those who get sicker if you're monitoring them. And also if you can get it testing for return to work. We will be offering that through Rako Science, and also you can buy it at the moment on our website under the domestic unvaccinated passenger product that we've got. So those really covers the tools: social distancing, testing, tracing, and rapid isolation and vaccination. They remain all important for getting your business through and dealing with the war of attrition. And then finally, finishing up, so I can answer any questions. Is this the last variant? Is this the last surge? And the answer comes from Andrew Reid, New Zealander who's at Penn State University. He's the director of their life sciences. And he said there isn't anything in theory or experience with other viruses to say that the next variant is going to be less or more virulent. We've got, so his view is that it could be the next variant could be less virulent, and people won't feel as sick, and they'll be able to continue to work. That's one scenario. The other scenario is that the next one could be more virulent. So there is nothing really to predict what's next. And so the idea of putting in place systems and preparing for the Omicron surge, it will serve you in good stead for the next variant, whatever that is and however that plays out. So that's not really good news for people, but I think as leaders in your community, as leaders of your workforces, I think now's the time to step up and to put in place the systems that will keep your people safe and also keep your business operating as best as it can in what is going to be a very difficult time. So there you go, Patrick. I think that's there's a lot more that I could talk about, but keep it short so we can go into questions. There he comes.
Thank you, Leon. That's fantastic. I very much appreciate your presentation there, and I'm sure people found that sort of very informative. Look, I have a couple of questions, really around this. Firstly, around the support that you think businesses could or should be providing to their people. You talked about the phone calls. Why is that all necessary, and what's the best advice you would give to businesses around that support for their teams?
Well, I think someone's going to have to do it, and I think they're only the best, at times of what we're going to go through, which is a crisis. That the business owners and the people running businesses are the natural leaders in a community, and so you have to be very careful that you don't burn yourself out. But I think you need to be putting in place in your teams a telephone tree to make sure that as people report that they've got a sore throat or they're getting a sniffle, they're getting some symptoms, that you're staying in touch with them. So because you can't assume that their families will do that. We know that the public health system will not be able to provide that level of support, and people, you don't want them being isolated at home, getting sicker, and staying in touch with them will allow you to connect them up with a district nurse to follow up, get a pulse oximeter to them, and have the ability to escalate them to go from care at home to the hospital if they need to, because the hospitalizations are going to be high because so many people will be getting sick at the same time.
Fantastic, thank you. There's also quite a lot of discussion around the use of rapid antigen tests in businesses. Businesses are putting a lot of store in the rapid antigen test. What's your advice around the use of those tests in a business, and when and how a business should use those tests?
I think they are better than nothing, but not by much. There's quite strong data that suggests that they are most effective only at the point of peak infection, so they're not good at stopping spread. And false negatives are the biggest risk because they lead to false confidence. And what we know from the physiology of the virus is that 70% of the virus is shed before peak infection. And so waiting for the rapid antigen test to go positive is basically 80% of the time at best, you'll be able to pick people up at peak viral load, but leading up to that peak viral load, they won't work and they won't stop you spreading the virus to your friends, families, and co-workers. That's pretty clear. There are use cases which for rapid antigen tests that we support. If you've gone positive, they can be very useful in tracking your illness to the point where you go negative with a rapid antigen test and can return to work. So they can be useful as a signal of when a couple of negative tests in a row after you've gone positive, that can be useful, and they can be useful for if people can do them every day for personal use, but we're not going to have them in the country to be able to do that. So rapid antigen tests have sort of been presented as like a magic bullet, because I think we were denied them for so long by law that people thought, this is the stuff that we need. But I think, if you look at any of the science and any of the evidence, they simply aren't going to be useful at stopping spread.
Thanks. We've got a question from one of our listeners or watchers, which was, how critical do you see having a pulse oximeter being?
Well, they have problems. I mean, I think the pulse oximeter, this is out of my depth here. I'll just declare that I did political philosophy at university, and so I'm not a doctor. And I think they can be useful, but certainly there are problems with pulse oximeters for people of color. So, Maori and Pacifica, these are light reading. They use light, and so darker skin can lead to false readings on pulse oximeters. So you have to be careful. I think, it's a tool, and everything is useful as a tool. I think that the health check and making sure, and being really clear, can you walk? Have you been walking? Are you short of breath? Is just as important, I think, as pulse oximeters. And so it's the shortness of breath that when, people start to get very concerned with people at home, and we just don't want, as a society, and you don't want in your workplace, people getting very sick at home alone without treatment and potentially dying. Because, most people that get treatment, and the treatment protocols are getting better, most people recover. And so we don't want unnecessary deaths through this Omicron surge. During the Delta surge in November and early December, there were, I think, 2 or 3 unnecessary deaths in Auckland because no one had been doing health check follow-ups. And so we've got to avoid that this time.
So really that comes back to that your earlier point around the support and care that you're putting around both your employees and your friends and family with regular calls to understand and ask them about their health. That is really important then.
Yeah, and do it in a structured way. So get a spreadsheet, log the time that the calls are being made. So if you get a team that's doing the telephone tree, get them to log the time they made the call. Maybe ring at 9:30 in the morning, saying, "How was your night?" Ring them at 3:30 in the afternoon. "How's your afternoon going?" And just sort of touching base with them and asking them welfare questions. And do you have enough food and to make dinner tonight? And then asking some basic health questions. And I wouldn't want to give you those questions. I think that's something that, Patrick, you could probably get a GP to provide you a list of questions for your members as a health check.
Yeah.
I think just getting some really organized and practical and just using mobile phones and making sure that you're all fine. I think that would be one of the most important things to do.
Cool.
And we do offer, and we will be offering in the Hutt Valley one-off tests pretty soon. And so they could be used for return to work as well. So that people are safely returning to work. But the other thing I'd really recommend is pulling your teams together and talking about what they can do to keep themselves safe, to flatten the curve.
Cool, thank you. Are there alternatives to the rapid antigen testing that you would kind of recommend? I know that you talked earlier about some solutions that you have.
Well, your PCR saliva test is the most accurate, and that's the great strength of our test. Is it's at least, if not more accurate than nasopharyngeal PCR, and it's not invasive because it's just a matter of people providing some drool from the glands around the sides of the mouth, and our test is also excellent, like in the first 36 hours of infection, picking up that somebody's infected and can interfere and stop them. We can identify the person who's positive before they're infectious, before they're spreading it. So that's very useful. Now, a lot of firms can't afford our surveillance testing program because there's high numbers of people and high numbers of testing. So you need to have, people like Fisher & Paykel Healthcare need to continue to run their manufacturing operations to deliver respiratory equipment to the world. And so we have a significant operation in Fisher & Paykel Healthcare. But one of the things that you can do is, in terms of return to work, is that we will be providing a product which won't be free, like the rapid antigen test will be from the government, through our website, rakoscience.com. And so that, at lower volumes will be more affordable for business, and it'll be the most accurate test in the market.
Fantastic. So just thinking about, we're in our offices or in our manufacturing sites across the Hutt Valley, people are working in close proximity. So what's the kind of close contact recommendations that you would have? I mean, when is somebody going to be a close contact working in those sorts of environments? And what's some advice for businesses about managing, the closeness of people working together?
I can't remember what the current public health definition is, but I think it's, within 2 meters for more than 10 or 15 minutes is the close contact definition. And so, that would be as good as anything. I mean, of course, you can catch it off somebody in 10 seconds of contact. That's pretty rare. But the other thing I'd say too is it also depends on the context. If you're inside in a not well ventilated environment with the transmissibility of this particular variant, close contacts is a completely different thing to whether or not you had smoko outside 2 meters apart in a Wellington wind. And so there's no doubt that is a much lesser risk than inside poorly ventilated spaces. So I think very much about how much in your business, you can bring in natural air ventilation and how much of your work that you can do in terms of people working from home, particularly the critical ones, if you can, having A teams and B teams, I think that's really important. So that, if there's spread in one of the teams, there's another team that can do that. We do that in all of our laboratories. We have an A team and a B team, and they don't cross over and they don't meet, so that that our laboratory can keep going. And we also test every one of our employees every day, but we can. So it means that we'll be catching them early so they don't spread it to our customers and to each other, our workforce. So,
great.
But
great.
yeah, so those are things that I do.
Yeah. And look, finally, you have talked about the testing times for rapid antigen testing. What are the testing times and results times for the work and the testing that you do at Rako Science?
Well, the thing that drives our 99.9% sub 24 hours, and we've done since November well over 250,000 tests. So it's a pretty good effort. The average is 8 hours and 15 minutes, and the standard deviation around the average is narrowing and narrowing. So we're pretty proud of that result. And the reason that we're able to deliver that so quickly, not rapid, not like a rapid antigen test, but we can do that quite quickly, is that the saliva test that we licensed from the University of Illinois is highly amenable to automation, so liquid handling robots. We do a heat step on the saliva, which cracks open the capsid of the virus, which means you don't need RNA extraction. The heat step also kills the virus, which means that when the sample arrives in the laboratory, it's much easier to handle. So with robotics, we also developed, our background is in complex systems and IT systems. So every line of code in our collection systems, every line of code in the laboratory and in the reporting systems we developed ourselves. So we're very confident. We do singleton testing. We don't do pooling of samples, so we won't collapse like was experienced in Australia and we're starting to experience here. Every test is is on its own in the process, and then basically the limiting factor on our turnaround is the courier time. So getting it on the plane and up to our laboratory in Parnell, up in Auckland we offer a sub 6 hour test. So Piers organised a test for a customer this morning at 8 o'clock. And the result was being delivered at 11:30. So that was a sub 6 hour, but it was, we can do sort of 3.5 to 4.5 hours. We'll continue to invest in our staff and our resources to make sure that, I guess because we started this business to deal with a pandemic, we built all the assumptions of our business around pandemic scale. And So we know that our systems will cope. We know where the bottlenecks are. We know how to add resources to deal with those bottlenecks. And we expected this problem, and so we know we can cope with it. Patrick, you're on mute.
Sorry, that's a bad mistake. Thank you so much, Leon, for your input, your expertise and your advice for our businesses in the Hutt Valley this morning. I'd just like to, thank Rako Science for the work you're doing, which is absolutely amazing. So you should be very proud of your activity there. So thank you for the advice. For any of the Hutt Valley businesses watching, if you need further advice or assistance, please don't hesitate to reach out to the Hutt Valley Chamber. We will put Leon and Pier's presentation on our website in the next few hours or next day or so. And again, if you need any further assistance, please don't hesitate to email us or reach out. Thank you so much. Thanks for listening, and have a great afternoon.